community dialogue, we talked of that too. It helps so much in handling conflicts that want to arise.
But in Amanja, I come from Kakoro sub-county, Pallisa district. Me yesterday, I learned about how to use these tools, the ICT tools, and how to open a data kit, and to open up a blank form and to fill.
As for the equipment, I also second my other people who have said it was a chance to handle some of these equipment, because the gadgets that we have are the olden ones. So when we got these ones, it became sort of a challenge. Opening was a problem. We tried to press the switches when it was not coming on, so that was also a challenge. But eventually, when we did over and over, eventually we became familiar to the thing. I personally got a chance of opening up to the end of filling everything and even sending. So I am happy that if now I'm given the thing, I can open, continue, fill, and send the data. So there's something at least I've grabbed.
Like last time we had forms to fill, recording the information from the patients, but this time, at least we used this one and I learned how to store information and I learned how to delete it. So I pass this to me.
Yeah, all done.
Okay.
Okay, thank you. Naiboka Victoria, yesterday we learned about the open data kits, where we had the scorecard, the exit pool, and the community maternal death notification. That's all.
In Kabole Health Center 3, the issues that we came up with, and that was the time we were here, like in June, we were here for the community scorecard approach, and then community came around, we identified lots of issues that were concerning the management team that was not also working as a team of the health unit, and also the structure that was actually taking now 3 years when it is not commissioned. Now, in our intervention, we have realized in between June and September, as I'm giving this report today, there are progress, there are achievements that we have realized. One is that the working relationship between the clients and the health workers has improved, in that now when we visit the hospital or the health unit, you find an amicable situation. Members of the community handle the health workers together, and the patients are also handled in a normal way. The other issue that we also handled at that time was the information gap between the management team of the health unit, in that the chairman and his team did not have the basics of what they are expected to be doing as the management team of this health unit. But having gone through, but other thorough sharing with the community and also empowering the management team of what they're supposed to be doing, we see now an element of advocacy coming in, because now the door that was broken that time after our intervention has also been put right. And also within us, the block that is soon to be commissioned is in the process of finalizing all those other challenges that have been on the way to make it commissioned for the community to be using it. The other issue that we are also appreciating UNSCO with is that other advocacy approach of them has helped us as a community facilitator to keep on disseminating the information to the community, that they realize the empowerment, and that it helps them to advocate for what they deserve.
Let me say some changes has come in to this unit, whereby we've been having a problem of health workers. They have been coming a bit late on duty. Now they can come in time and they are often there. Secondly, about the changes still, is that we've been lacking the drugs, has been not coming in time. These days drugs comes in time and in good numbers, whereby it was after this organization fighting much with the communities and the health workers, like the in charge, to make sure that we air out those
Tell
problems.
you about the scorecard. For this health unit particularly, it helped us a lot to wake up about the health unit management committee. It was down, some had served for longer. We didn't know who are those people who would qualify easily for that, for serving that. Some people were too young to serve. The committee didn't know them. Now when we came up, when UNSCO came up with that committee scorecard, we were involved on identifying who are the members of the Health Unit Management Committee, their qualities, and actually the chairperson had to identify the real members, and by virtue that they are normally appointed, we had to tell who are those members who had served for long. And we discovered those who had served for long were the people who were staying off the committee. They were not inactive. So for their being inactive, the town clerk had to first keep them aside, got some other volunteers. By choice of the chairperson, they took over. Now we are seeing the purpose of the health unit. Then the other thing is about the community. The community has not been knowing that there's this they're supposed to have a management committee around. They thought the government leaders are the ones to lead the health unit, and at times guide them on what's happening. You would lack drugs. Instead of someone complaining to the management committee and getting a reason from them right away, first move to the RDC. RDC begins calling the DHO. The DHO begins calling stores. It doesn't answer the community, but instead just gathers drugs from other health units, sends directly to the what? And the community would think, because they went to the RDC, this is the reason why we got drugs from somewhere hidden. Yet, in actual sense, a step would be taken, but the truth would still remain that we had no drugs at the unit.
Because even the staffs had some wrangles within themselves. Then there were wrangles between the community and the staffs. But since we came together the other time, especially when we had a community dialogue, when we were conducting a community scorecard issue, now we have got so many things that have changed. We see the community now very friendly, as you even get from the health providers here. They are no longer in loggerhead with the community. Things are going on smoothly. But though it is like that, you can't miss out some simple things that always occur. But on the general part, UNHCO has really done it. Because in terms of the compound, you can see. During the other time, we didn't have those flowers planted. But now, there is an extension of flowers being planted. And this is voluntary by some of our workers. The other time, we were almost forcing them to do things, but now they do things voluntarily, which means there is that.
See now, people are also pressurizing the health workers about their rights. So we need to talk more about with them about where to end their rights, such that they cannot go beyond the limit. Because you find that it's tested negative to malaria, you will say, you must give me water. Because I came here when I want water. It's my right. So, that's my observation. But there's a change. I can see when the compound, it is now clean, than it was. People whom we interviewed today, they were very happy to see that we are using technology. At first they said when they talk when you are writing with a pen, they assumed you don't write the exact what thing. And they appreciated the writers. They were confident to give information because they were alone. If we wanted to talk to comment about the health worker, he was free to talk about it.
So which means it will impact according to what you wanted. It is going again to impact more, simply because now they have again developed more confidence.
Because more others even wanted to be interviewed before. You interview me also. I have some issues.
Yes. They were almost lining down. Towards the end, they were almost lining down.
Yeah.
Interviewing.
Yeah.
Right now we said no, we are interviewing only those people who have received services here. Because we want to find out how the services are. For the betterment of the services, we want to get information from you. Kasi ati ane kwatagana na staff ya bali ku duty batela bakunengeri jiba display nga
kale dalade
mbe ati ano ebikwatagana PHC fund nga kidi chimbo no kitepe kudi ba display nga
biliwo
ati antete ebikwatagana idembe lyabalwaire batela bino kukita active batimba kukitempa ko naye jja kumusana
batimba era tuko kubisoma lebindi biriko
Master head position. That is what they call.
Mami wani ndio ikajata ina. Ndio kila application yetu wana nini. Mami wani ndio ina. Ndio show application. Mami wani ndio.
Mama cheka
kuna
maybe when you say something muteso ngugwere not at all. Yeah.